I've had a lot of people ask me specifically when the health care bill is going to be released to the public, why it isn't public. The short answer to the question is I haven't seen it yet either.
That is Senator Mike Lee, a Utah Republican, addressing one of the biggest questions Americans have about this Republican Senate health care bill. What's in it? Senate Republicans will see a draft for the first time tomorrow morning. Here's why it's interesting what he just said. Senator Lee is actually among the authors. The group of 13 men compiled by the Republicans to draft a bill. It has not been a public process. There have been no hearings, and it's been a remarkable turn of events considering what some Republicans who are in that working group were saying back in '09 about how Obamacare was drafted.
Americans are asking the Democrats to put party loyalty aside tonight, to put the interests of small business owners, taxpayers, and seniors first.
They want to make sure they pass it before the American people find out what's in it. Because the American people, by nearly 2 to 1, according to the CNN poll, don't like what they've heard about the health care bill.
I want to make sure my health care is not going to be made worse by what's going to happen in this in the Senate between now and the end of the year. When Americans voted to change Washington last year, they didn't think it would be politics as usual here, but unfortunately it's sunk to a whole new level.
Only one party, and especially one person, gains from this so-called health care reform bill. The president will be able to show how he was able to accomplish something against all odds.
After weeks of closed-door clandestine negotiations, Senator Reid finally emerged with a 383-page Christmas list. This bill is a dark example of everything that is wrong with Washington today.
They want to push through here. They want to finish it before the Christmas holiday. They want to get this in the rearview mirror before the American people have an opportunity to see what's in it.
We are joined tonight by the former chairman of the Republican Party, Michael Steele, and longtime radio talk show host in his native state of Wisconsin, Charlie Sykes. Gentlemen, welcome. So, Michael, just from a television standpoint, they make it too easy. That's an open net. That's due diligence. We have to do that. That's the very basics. So, from a human standpoint, as I keep saying here night after night, real Americans are scared to death about the status and future of their health care. Michael, what's about to happen and what should happen?
Well, I think what's about to happen is going to be not that much far removed from what has already happened with the House bill, and that is this. I think the Senate, for all of the machinations and the noise that has been built up around this bill, it's going to hew pretty closely to what you see in the House, because the idea here is not just to get a bill that won't get through conference. They need a bill that the House and Senate Republicans can at least come somewhat to the table on, and I think that's going to allow them the space that they need to do that. Last night's elections helped that argument as well. They see where the base of the party is, standing very firmly with the president and the candidates he's supporting, and all this now begins to pile on top of this particular bill, and we'll push it out sometime tomorrow, and then, of course, into next week for a vote.
So, Charlie, A, is this any way to run a railroad? And B, this is a potential win. This is a big chance at a win for the Republicans. Do you think it's going to have a W next to its name?
It is a very, very dangerous win. Look, Michael Steele and I are both old enough when both of us were railing against the Democrats for ramming through the process. You know, and you look back, though, in the comparison, and by the way, this was a legitimate complaint about the speed of all of this, and it helped detoxify Obamacare. But here's some key numbers. The Senate Health Committee had 47 hearings or roundtables. The Senate Finance Committee had 53 hearings on it. The U.S. Senate had 25 days of debate before they voted on this in December, and the legislation wasn't passed until March of 2010. Now, contrast that the same folks who ran on this, who rode the Tea Party wave into office, are now talking about rolling out a bill that no one has seen rolling it out tomorrow and having a vote before July 4th. I mean, look, there was a time when conservatives took process seriously because they understood how dangerous it was to have elite political figures in Washington making decisions for tens of millions of Americans, but apparently that's all been forgotten.
Yeah, Michael, Charlie has such a Capra-esque, wistful version of the past in his mind. Michael, when you talk to Republicans privately, and I know they all talk privately, what are you hearing?
There's a lot of concern about this. There's a lot of bad fruit that's dangling from this particular vine. Pre-existing conditions, Medicaid expansion. You know, will I be able to keep my health care? How much will I pay for that? They have no answers for this. The fact that they've not taken the time to sit down to invite to the very table the people who have an interest in health care, starting with the consumer, the patients, the parents, and then going into doctors and all the other adjuncts that go along with putting together a health care package. They haven't done that. So they don't know what the reaction is going to be overall, and a lot of members are nervous about that. They think that they're just going to get this thing voted and off the table, and then we're going to focus on infrastructure, $1 trillion. Then we're going to focus on tax cuts. We don't know how much that's going to be. And they're playing to the Democrats' card when they start putting in place those pieces that say you're doing everything that benefits not the least among us, but those who have the most among us, and that's a problem.
And Charlie, does McConnell have a bare 50 to deliver to this? And if so, to what end?
You know, we will find that out. That, of course, is one of the many mysteries in Washington. But I think that Michael's absolutely right, that at this point, it's all become about a W. Just get this thing through and then move on to tax cuts. You know, as somebody that's spent a long time saying, no, it's not true that conservatives want to strip poor people of health care in order to give tax cuts to the rich. Now the Republicans have really paired the two issues side by side. And he's also absolutely right. One of the dangers of doing deals like this in secret is they are highly risky. There's a reason why we have transparency. It's not just good government, it's just smart decision making. This is very risky business.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.